Hi, my name is Lisa Brideson-Glynn. I'm a pediatric speech pathologist, a certified oral motor therapist, and a feeding specialist. Thank you for joining me today for this mini lecture on poor saliva management, or more commonly referred to as drooling. Why does drooling occur? It occurs because a child has reduced ability to feel the oral secretions, and they also have difficulty with their motor control. The possible areas of saliva control can be impacted by postural stability or instability, reduced sensory awareness, reduced motor strength for control, and also swallowing. Treatment for drooling depends on its severity, but it is best approached through an interdisciplinary team. This team can consist of an occupational therapist, a physical therapist, a speech pathologist, a special educator, and of course the parent. But how can we treat drooling? I approach drooling through a multi-sensory motor approach. I start by looking at how the child is seated. I want to ensure that the child is seated in an appropriately sized chair. Their feet are planted on the floor. By having the feet planted on the floor, it gives the ankles, the knees, the hips, good stability, and this impacts on the child's core stability. Core stability, truncal stability also impacts on oral motor control for stability. Children often have reduced intraoral awareness of their oral secretions. This is known as a hyposensitivity, and the hyposensitivity can be correlated to drooling. The reduction in the sensation of the saliva in the mouth fails to send a signal to the brain in order to trigger a motor function for swallowing. So what happens, the saliva builds up, and you often see pooling of the saliva in the mouth, on the lips, and then ultimately on the perioral area. So if children are not feeling the oral secretions in the mouth, again, it is not sending that signal to the brain in order to trigger the motor function to swallow. And this is an ongoing communication between the sensory system and the motor system. The sensory system needs to send that signal to the brain in order for the brain to send a signal to the motor system to trigger a swallow. So how do I treat drooling? The first thing I look at is a child's diet repertoire. I'll have a parent write out a 2 to 3 day diet log. And I look to see not only what the children is eating, but I want to see what the flavors in that food may be, what the texture is in the food. Children typically don't feel the texture and the consistency and the taste of the food. So we'll start by looking at the diet and seeing where we can add flavor. I often suggest flavors such as garlic or Lowry seasoning salt. But then I also look at the texture. If a child likes to eat a piece of chicken, we may want to bread that chicken so that the crunchiness of the breadcrumbs gives that child increased intraoral awareness. We'll also approach the saliva through an intraoral sensory system approach. I like to use tooth thets. I like to use 2 of them, and tooth thets are dental swabs. They come in pink, blue, or green. And I like to always have a cup of warm water and a cup of cold water. And I keep each toothette dipped in the water. And then I'll wring it out just to get all that extra wetness out of it. And then I'll put it into the mouth, and we use a C swipe. So we start at the back, we work towards the front, go to the back, and work towards the front. And the texture of the toothette and the temperature raise the child's ability to feel the saliva in their mouth, and this will cause more repetitive swallowing. I also like to use a Z vibe with a yellow prefer tip. So the Z vibe turns on and gives it vibration. And again, we'll use that C motion. And this builds up again the child's intraoral sensory awareness. I also like to use oral placement therapy. And by using the oral placement therapy, we want to increase the muscle strength in the oral musculature so that the child has better motor control. I like to use the Z vibe with the Mickey Mouse head. I turn it on, so I'm giving the child sensory feedback, but we're also engaging in lip presses for motor feedback. I'd like to engage the child in horn blowing, the repetitive motion of the lips builds increased muscle strength. So building that increased muscle strength will build better motor control for better saliva control. I also like to use a lip press, another lip press exercise, the tongue depressor exercise. Now, some children are not ready to go right to the tongue depressor exercise, so you may start out with a circular makeup sponge. If that's too easy, we may move to a coffee stirrer. Again, if the coffee stirrer is too easy, then we go right to the tongue depressor. And once the child is able to hold the tongue depressor for 25 seconds, I then add weight to the tongue depressor by adding pennies onto each side. So it's like a barbell. We're just gently increasing the weight to put more strength on the muscles. I hope that you enjoyed this segment on drooling and different remediation techniques for drooling. And please enjoy the following videos of the exercises that I mentioned. Thank you. So this is the beanbag exercise. We're going to start again under the ear, and we're going to move towards the corner of the lips, applying firm pressure. And then we hold the back of the head while we firmly tap on the lips. The beanbags have all different textures, and you don't need to use these beanbags, but you can use stuffed animals, washcloths, face cloths with different textures. This one's furry. And then we have corduroy. So all different textures. This gives increased awareness and input into the perioral area, specifically the lips. So this exercise is a lip press exercise. This exercise is designed to strengthen the lip muscles. So we have this muscle around the mouth, which is the orbicularis, and we have this muscle, which is the mentalis muscle. So this exercise is great in strengthening the muscles, but it also helps with more saliva awareness on the lips, because we do use our lips when we swallow. Sometimes children need to start out with just a coffee stirrer. The hierarchy of this exercise, we typically start with the tongue depressor, but it may be too hard. So I usually start with a coffee stirrer and put it right between the lips. I would count to 25, and as you can see with Nora, that's very easy for her. So then I would move to a tongue depressor. Press. And again, you can see it's very easy for her to engage in this exercise. She has good truncal stability control, which then gives her good oral motor control. Now presently, Nora has 4 pennies on each side of the tongue depressor. So it's a little heavy. Okay, I need you to sit. Thank you, and here we go. We're just gonna count to 10. Press. Whoa. Okay, let's wipe your lips. Up. We'll give the tongue depressor a little wipe. Okay, and here we go. Just relax. Shoulders down. And here we go. We're just going to do it for 10. Look at me. Thank you. And press. 1, 2, 3, 4, 5, 6, 7, 8. Whoa! Okay, so normally Nora can hold it for 10 seconds, but it's a little harder for her today, so 8. We'll just hold it for 8 seconds. So this is the horn blowing exercise. This is the number 1 horn from Sarah R. Johnson's horn hierarchy. And it's a flute, and you can see all the holes. So it's one of the easier horns to blow. This exercise is great because it targets different muscles in the body. So it targets the diaphragm. This enables the children to learn to blow from the diaphragm. And more importantly, it teaches the lips how to dissociate from the jaw, to engage in a lip press and release, which also happens when we make the M, B, and P sounds, but also it helps with the saliva management. So Nora's going to blow 5 times for us. Ready? And blow. 1, 2, 3,